Hi, I'm Angie Westbrook. I'm a cosmetic nurse at Aesthetica Cosmetic Surgery and Laser Center, and today we're going to talk about facial fillers. So there's three main fillers that we use. Fillers would be your hyaluronic acid fillers, Sculptra, which is a polylactic acid filler, and the third actually isn't a filler, but it's fat. Your hyaluronic acid fillers are wonderful because they're a nice, soft, natural material. There are different types of hyaluronic acid fillers we use. For the most part, we use the Allergan family of fillers. So let's talk about what we do with fillers. With fillers, what we want to do is add volume to the face as it ages. We are working on correction, so we're working on areas that we're notice aging. We're also using fillers for prevention, so fillers can prevent aging in the skin as well. We want to keep the face youthful. The temples, the cheeks, the upper face, we want to keep that nice and rounded, and we're going to use a filler like Voluma there. Voluma adds the most volume and gives lift and support. Voluma can last up to 2 years, which is a fantastic benefit of this filler. So we're going to add a lot of volume, we're going to get lift and support, and we're going to have a filler that can last longer than some of the other hyaluronic acid fillers. The next filler is Juvederm. Juvederm is a fantastic filler for the lips. And we think about the ability that Juvederm has to attract moisture to it. It is going to add a lot of plumping value. It's going to give back volume to the lips. We can get fine lines that we want to correct with Juvederm. The next hyaluronic acid facial filler we want to talk about is Velour. So Velour is relatively new, and it's something that we want to use in areas like the nasolabial folds or the lower face and in the marionette lines. It's a little bit softer than Juvederm. It attracts a little bit less moisture, so you're still going to have some nice plumping value to it, but it's going to move very naturally in the skin. It's going to be just a little bit thinner. So now we want to talk about Volbella. Volbella is another hyaluronic acid filler. It's the last one we're going to talk about, and Volbella is very unique because it is the thinnest of the hyaluronic acid fillers that we use, and it's designed for a patient that wants to augment their lips, but it's also perfect for the lip lines above the mouth, where something like Juvederm is going to add a little bit too much volume there because these are fine lines, and we want something very thin to help fill these superficial fine lines. We also are going to use Volbella in the lips themselves for a patient that doesn't want too much volume. We talked about the hyaluronic acid fillers. Another filler, which is a pretty unique filler, is called Sculptra. It's not hyaluronic acid, it's something called polylactic acid. The reason that we would use it instead of one of the hyaluronic acid fillers is if we need a lot of volume. So in areas where we want a lot of volume, we want correction that's gonna last longer than the hyaluronic acid fillers last, and the body creates collagen around the polylactic acid. So it's causing your own body to produce collagen in areas where we want correction. It's perfect for doing areas like the temples, where we need a lot of volume through here. We want to come down, through the cheeks and add some good volume in larger areas. It's the perfect solution. A third option that we have, so we have the hyaluronic acid fillers, we have Sculptra, and then we have fat. So fat is a unique way to add volume to the face, and it's something that's called a fat transfer. So we're taking your own fat from an area of the body where you might have fat that you don't want in that area. We're taking the fat and we're using it to add volume to the face. So fat can be done anywhere. We can do it in all the areas that we talked about that we use the hyaluronic acid fillers and Sculptra, and essentially inject anywhere from 10 syringes of filler, 30 syringes of filler. It's really amazing what we do with fat. We are taking enough fat to really add all the correction that we need, and it's going to last a lot longer than the other fillers that we talked about too, even longer than Sculptra. Maybe we don't have temples that have hollowed yet, but they're just starting, or the cheeks are just starting to lose some volume. So we're going to put in some filler to keep the face, to maintain the face at a youthful state. But when we think about something like fat, we can take the fat and inject it in a way that it's providing great correction too. So fat's a great option, something to think about as well. If you liked this video today, press like. To see more videos like this, please subscribe and tune in and watch other videos that we have.